Good morning and good afternoon, everybody. My name is Anja Giphart. I am the Executive Vice President for Medical and Scientific Affairs at the Elizabeth Glaser Pediatric AIDS Foundation, and I would like to welcome you to this webinar. We are very excited about this webinar. For those of you who don't know EGPAF that well, our mission is to seek the ending of HIV and AIDS globally in children, youth, and families. And so therefore you can see that this program and this project is very dear to our heart. We do our work through program implementation, global research, technical assistance, and focusing on public policy and advocacy. And we're really happy to present this webinar to you together with our partner and donor, ViiV Healthcare, who shares a lot around our same mission. Maybe next slide, please. Walking through this webinar, we're happy to have Cathy Ferrier here also on this webinar. Again, our donor and colleague who shares very much the same mission and focuses on the same type of work. We are very happy to have a close collaboration, and we really look forward building further together on the future implementation of innovative solutions to optimize the prevention and care and treatment for adolescents and youth. We will subsequently have Natella, who will talk a little bit more about the design and the implementation of the Red Carpet program. We will have Judith and Cosima talking about the Toolkit. Job will talk about the Kenya experience, and Cosima will be able to cover for Tessa, who unfortunately won't be able to be with us today, about the Malawi experience. We have Robert talking about his own experience in the program. And then at the end, we will have Brian White talking about strategic opportunities for the adaptation of the model. And he will moderate the Q&A. Next slide. So you might have noticed already, everybody is automatically muted, and we really would like to ask you to engage during the presentations through the Q&A box. If you will type in your questions there throughout the webinar, then we will get to those at the end. If you have any connectivity issues or other kind of logistical issues, please use the chat box for that. So now that we have gone through these kind of logistical issues, I would really like to again thank ViiV Healthcare and would like to introduce Cathy Ferrier to say a few words before we go into the presentation. So Cathy, over to you.
Thanks very much, Anja. It's great to be here, and my name's Cathy Ferrier, as you can see, and I head Positive Action for ViiV Healthcare. And Positive Action is focused on supporting community-led programs to support people living with HIV. And we've been delighted to support this project since 2016. And it's a great honor to be here today to discuss it and to discuss the progress and also the results of the work with you all. Positive Action and ViiV Healthcare made the investment into the Red Carpet project as it's aligned to our strategic interest in replicating successful models and also to expand the evidence base of those models. And we, as Anja said in her introduction, we share EGPAF's vision to see the Red Carpet program adapted, enhanced, and then brought to scale to give the sort of support needed by many more adolescents and young people living with HIV. And it will be really interesting to hear the presentations that will follow around the results of the work in Kenya. And I'm sure that this will be incredibly helpful in ensuring that the program can move forward and providing the really holistic support around the young people that they need to ensure that they can stay healthy and fulfill their potential. And it'll inform the replication and adaptation and enhancement of the model in different contexts. So I'm looking forward to hearing all the presentations that will follow. And it's really heartening to see the expansion of the model to Malawi last year as well. Given all of the challenges that we have faced in 2020, it's all the more important that we're not diverted from our commitment to leave no person living with HIV behind. And having worked closely with adolescents living with HIV in Southern Africa for many years, I'm aware of the many challenges they face and the barriers to care and effective treatment. And what's impressive about this project is it puts that young person right at the centre, from peer design to peer support, and linking all those people around that young person, from teachers and heads of schools to healthcare workers and the people at the facilities, to parents and caregivers, creating that fully supportive environment to support the young person. We really need to continue to put all our energy and focus and commitment into providing this sort of holistic support for adolescents. And at Positive Action and at ViiV Healthcare, we're committed to continuing to play our part in that. We are continuing to partner with EGPAF and hope to see that partnership continue to flourish. We have a number of ongoing projects in addition to this one with EGPAF. And we are, as Anja said, very much aligned in terms of our vision to supporting the end of pediatric AIDS. So without further ado, I think I can't wait to hear all the rest of the EGPAF team and their updates. So I'm going to hand you over now and say thank you for all your work, EGPAF, and for everyone involved in this programme. And we'll continue to be here alongside you. So I'll hand over now to the next speaker for an overview of the programme. Thanks very much.
Thank you very much, Cathy and Anja, for this introduction. And I'm thrilled to talk to you briefly about the concept, design, and initial steps in implementation of the Red Carpet program. Next slide, please. So we launched Red Carpet program with ViiV support in 2016, and it was designed initially to really focus on a very fragile period of time after the young person hears for the first time that the test is positive for HIV. We really wanted to capture the first 6 months after learning of diagnosis on early linkage to care, making sure there is ample support and welcoming surrounding for those young people, and retain them in care, to give them the great startup of their journey. Unfortunately, as of now, still life journey, but yet the journey with HIV throughout their lives. We started with a youth aged 15 to 21 years of age, but quickly expanded to embrace other ages as we saw the need for this program to grow. We also started by focusing at 6 months, as I mentioned, but realized that the support and the structure and the welcoming environment we're building around the Fast Track program, and Fast Track really is a main component of the Red Carpet, not only welcoming, but also facilitating, gliding along this path and entering the service point. We also decided to expand this beyond 6 months period, and in fact wanted to embrace this package of services to all youth aged 10 to 24 years of age living with HIV. As I already mentioned, the program provides really approach to the youth-friendly Fast Track services. We, not for nothing, chose the name Red Carpet. We really wanted to cherish and honor our youth, giving them very important person or VIP experience everywhere they came across with their journey. Would it be healthcare facilities? Would it be supportive learning institutions like schools? Would it be young people who work with them in the community at schools or encounter them at the healthcare facilities? And that linkage between community and schools, that reciprocity of supporting young persons through the environments where they spend a lot of time, really was at cornerstone of developing this program and moving it in, and yet hearing youth voices throughout every platform we crossed. Next slide, please. Next slide. Okay, great, thanks. And why did we focus on adolescents and youth living with HIV? We decided not to put too many statistics. They're quite well known. We just wanted to provide you a high-level summary. We do know this is a very challenging period of transition. We, in the parentheses in the first bullet, you see we've broken this age into several age groups, which is frequently used in multiple global interests, from funders to people who report data, statisticians, global advocacy platforms, 10 to 14, 15 to 19, 20, 24 years. And this is solely to demonstrate and to remind ourselves how uniquely diverse our demands and questions and needs and surrounding milieu and capacities to access care and education among these four age groups, 3 age groups that you are seeing on your screen. In each group, the needs are quite unique and they continuously evolve as the ages are crossed. And these ages are not written in stone, and some developmental aspects can affect them. But this is a just vague reminder to ourselves that this is really diverse group of population with very distinctive and diverse needs. We also know from multiple sources that the linkage to care is a fragile point. There is a significant drop of cascade of care from the point where young people learn about the diagnosis to the point of being fully engaged in care and receiving proper support. And we do know that if we did not succeed linking a young person to the care and treatment, we do have a lot of more morbidity. People get more sick. They die from HIV, which shouldn't happen nowadays if they are left untreated and on their own dealing with their disease. And therefore, the experience here of young people was really important to us. We do know that young people face multiple challenges, and many times more so than even younger children and adults. And it is very hard for them to reach full adherence. We do know that the viral suppression rates in this particular age cohort is spanned between 10 to 24 years is generally less optimal and less high numbers compared to the adult populations and younger children. Next slide, please. And that is really why we launched this program. And as I mentioned already, we wanted to interlink 3 components. We wanted to make sure that the red carpet healthcare facilities spoke and knew of the school community, and vice versa, that school community supported young people at the healthcare facilities. We also wanted, in the largest circle on your right, to make sure that young people not only were aware of the program, which is frequently the case, but from very beginning participated in discussing how this program should be designed, what kind of VIP services will be welcome, how to design the VIP card, where to keep it, who should give it to young person. So from very beginning, involve them in the design of the program and then continued working jointly with them throughout the whole cascade of implementing this program in Kenya and now in Malawi. Next slide, please. And as I close my introduction, before I sit to my colleagues who really rolled the whole work down in the 2 countries where we first piloted and then scaled up the project, I just wanted to highlight again that for us, that VIP approach was very important. Here are just a few elements of how we envisioned, and this is really at the vision level. You will hear much more details in a couple of seconds, how we envisioned the experience. We envisioned that at the red carpet facility, there would be a VIP express desk for young people, that there would be a separate room where feasible or separate space where the person could be welcomed for VIP experience to talk about health and well-being, that every young person who is living with HIV would receive an express card which would be honored and recognized across different points of care, that the client feedback forms would be distributed, that before the young person left the facility, we could hear their voices. We could ask them, how did it go for you? Did it work well? What didn't work well? Tell us, what can we do better? We wanted to make sure that all essential services were attached to that healthcare journey, that the referral services worked, that psychosocial support worked, peer support was available, etc. And definitely wanted to develop, and we did, multiple adherence support tools that could be used not only at the healthcare facility and support groups, but could be adapted in a school environment and community environment. And finally, at the bottom of the slide, you see the most important element where we took a step to develop. We wanted to develop better communication. We started by talking and sitting at the same table with ministries of education and ministries of health, and then moved on bringing teachers and healthcare providers in one room for trainings and mutual discussions. And everywhere we arranged this communication chain, we wanted to make sure young people were part of this dialogue and actually were the drivers of the decisions that would be taken as a result of this communication. So this is just a journal overview with a little excursus in the history. And now I'm very pleased to pass the conversation to my colleagues who will really walk you through the details of the packages we developed. Back to you.
Thanks, Natella. So folks, welcome. Following that background information provided, we are going to walk you quickly through the red carpet program package, and we are going to be using the word RCP a lot. So RCP here means red carpet program, and the global package is really intended to assist in implementing the model. And for those of you who've looked at it online, the package has been formatted in a way that's colorful and very youth-friendly, and so it can be used with your youth in your clinics as well. Next slide, please. So the package in itself consists of individually but linked resources and tools and guides. And what this means is that you can take a portion of the package and adapt to your own settings, or a project or program can choose to adapt the whole package. So the various components of the package are highlighted differently. And actually in the toolkit, each of these elements of the package have been highlighted in a different color, making it easy for you to use it as a resource. So the first part, in summary, so I'll briefly talk about what the package has as part of the contents, and then I'll quickly talk about the facilities guide. So the first part of the package has the summary of the red carpet brief. So basically, this brief provides a high-level overview of the red carpet model, outlining the different components. It talks about the objectives of the model. It highlights some of the evidence, and the evidence in this package includes the RCP manuscript that was published in AIDS 2017, and it has a lot of elements as well as describing the cadres and roles specific to the model. So really it provides an understanding on how to provide this intervention. And when I talk about the roles and cadres that are included, these roles include facility roles such as the RCP coordinator, the RCP clinical team, the nurse or the clinician, the RCP health records person, a multidisciplinary team, which is also called the RCP response team, adolescents and youth peer navigators, and also the RCP school team. And the school team usually would consist of the matron or teachers, and Cosima will talk a bit more about that. The second part of the package has the red carpet health facilities guide. I will be talking about this some more, but basically it offers resources and guidance on how to implement the RCP suite of interventions at facility level. The next portion is the red carpet community and school linkages, and this is basically providing direction on the implementing of the RCP for responsive communities in schools. And it also talks about how to coordinate between facilities and school communities to ensure you don't have any interrupted continuum of quality care and retention for adolescents and youth and students or learners living with HIV. The fourth part is the red carpet adolescents and youth living with HIV and stakeholder engagement guide, basically a guide to help you on working with the various stakeholders when it comes to adolescents and youth. And then the end of the package has some standard operating procedures, and Cosima will be talking more about this as well. Next slide, please. Now, if we go further to the red carpet health facilities guide, basically, like I mentioned, this is a guidance and resource to help with a suite of interventions at health facilities, and it is a guide for health facilities workers, healthcare providers, and other teams interested in adopting the red carpet services at their sites. So this guide is divided into sections, as you can see listed there, and basically it has the overview, and the overview describes the VIP experience that should be implemented, that should be valued, and it talks about respectful services for adolescents and youth living with HIV through the use of, one, the VIP help desk, the VIP express card, the fast track services, and also client feedback, as was mentioned by Natella. The second part of the facilities guide describes the goals and objectives of the red carpet facility. And in summary, it's basically aimed at improving access to the fast tracked HIV linkages to care, initiation to ART, retention and treatment services within the health facilities, and also linking with the communities. The third part of the facilities guide describes the RCP VIP services as defined within the facility interventions. So it combines a multiple of activities to assure a fast-tracked services for all adolescents and youth living with HIV, while creating an overall conducive environment. Natella already talked about the elements of the VIP services at the facility. She mentioned, like I said, the express desk, which is used for triage and navigation. We are recommending an express health room, which is a one-stop room for integrated services in confidential settings. She talked about the card, and on the card you have the patient number, we don't have the name, facility name, when they were enrolled on treatment, and a contact, and also instructions on how to access services. And the services also include the fast track services. And like was mentioned, this is essentially integrated services, including not just HIV services, but adolescent sexual and reproductive health services, such as pregnancy, family planning, post-violence care. There are issues around mental health services, including depression, substance abuse management, and general counseling, and other health services. So these are all integrated within the fast-tracked essential services. And the other services there is the client feedback, like Natella talked about. And the graphics you see on the left of the slide is an example of the red carpet client feedback form, asking the adolescent how they were served. And the next picture there is just a graphic for them to indicate how they feel using the picture. So a lot of resources that can be adapted for use at the facility level. It talks about the adherence support tools, like Natella said, communication, and also how to facilitate home and school visits. The next part of the health facility guide talks about how to set up an RCP facility. So it describes the steps to setting up an RCP facility, right from engaging stakeholders, identifying an RCP team, and it defines the team, like I mentioned, how to train and sensitize your RCP facility teams and to clarify their roles, how to assess for friendliness of the facility for adolescents and youth, how to implement the VIP fast-track services, and also it talks about how a district or a region can recognize a healthcare facility as an RCP facility. The next part of the facility guide, having talked about how to set up, it describes how a facility can adapt the model to local context. So basically, the model is designed with flexibility in mind to be able to adapt, to change, and mold based on local context. What is available and the gaps that are there. And when you hear the examples for Kenya and Malawi, they were able to adapt this model in Malawi based on the gaps they had and the local context. So again, it's created such that a team of providers and facilities and stakeholders are able to decide which elements they would like to contribute significantly to in the needs of the adolescents, so that is what they adapt from the RCP model. And then the facility guide ends with some associated tools. So again, the tools are meant to supplement the content of this package and align, and also is meant to align with national guidelines. So the tools involved a facility RCP checklist that can be used to ensure that all the elements that are desired are there, a facility RCP register that can be used to add on to the already existing register to collect some additional RCP related data, a facility school checklist, and the SOPs. And at the end of the guide, we also have the RCP client feedback form that Natella talked about. And basically, the form is important because the clients will be able to help us check program performance in response to the youth and the youth needs. So thank you very much. I'll hand over back to Cosima to talk about the rest of the package.
Thank you so much, Judith. Next slide. In the next part, I'm going to be talking about the Red Carpet Community and School Linkages Guide, which is a guide that provides resources and guidance on how to implement the Red Carpet program in the school context to support effective linkages and coordination between facilities and school communities to ensure quality of care and retention of adolescent and youth living with HIV clients and students. So there's various elements that constitute a responsive school, as we call it, a responsive school and community, some of which are shown on the slide in the graphic. So the first one is providing a supportive environment for adolescent and youth students in schools, which includes communication and education around HIV and AIDS in the school setting. Also providing comprehensive school-based support, which includes adherence, they would have confidential pill storage, for example, disclosure support, psychosocial support in the school setting, retention and stigma reduction activities with trained school staff, such as teachers or matrons, as well as adolescent students themselves. And also bidirectional linkages to healthcare facilities to ensure that those linkages do exist for refills, for follow-ups, for referrals to other services needed by the students themselves. This section also includes additional resources such as a caregiver or parent checklist when sending children to schools, as well as different responsive school checklists, as well as similar to the one that Judith mentioned for the facility guide. Next slide. The next section is the stakeholder engagement section, which provides insights and tools and guidance around the process for identifying and engaging with relevant and significant stakeholders, which could include national and local authorities in the health or the education sector, caregivers, teachers, providers, and adolescent clients and students throughout the planning and implementation and evaluation of the project. So it provides additional guidance around working with an array of stakeholders that have been identified. There are different activities and interactive guidance in the guide itself, such as the objectives, identifying the objectives, mapping the stakeholders, defining those, and then tips around working with different stakeholders and being able to adapt that approach to meet the local needs. Next slide. So the last section of the Global Toolkit is a standard operating procedures package that consolidates tools to complement the guides and to support the implementation of the Red Carpet project at the facility and the community. So there are 6 SOPs, so standard operating procedures, as part of this section that are covering different provisions of care, clinically, like enrollment, linkage, adherence, understanding viral load, but also different elements like empowering clients in building their resilience and responsibility in their care and re-engaging clients who have been lost in care. There's also an SOP around supporting adolescents and youth who are attending schools. So each SOP does go more in depth with step-by-step guidance and additional information. Like you see on the screen, there's a do's and don'ts figure when discussing adherence, so using youth-friendly language. But there's also other examples of that, like tips to support youth in their journey towards self-management, which are tips from young people themselves. Language in supporting disclosure, like providing links to EGPAF's disclosure toolkit and other guidance along those lines. Additionally, there are also an annex, as you can see in the table on the slide. There's 3 annexes. These are worksheets that can be printed out for use in different settings and are meant for both adolescent and youth clients and their treatment supporters, which can be caregivers or partners or anybody who fills that role. So we're going to move on now to hearing implementation experiences in Kenya and Malawi. So I'm going to pass it on to Job Akuno to share more on the Red Carpet experience in Kenya.
Thank you very much, Cosima. Could we get to the next slide? Yes. Sorry. Yeah, just get to the next slide. So Sarah, if you could get to the next slide. Right, so as the background has been provided by Natella regarding the implementation of the Red Carpet project. It's true that Kenya did the pilot of the Red Carpet package, and that began way back in 2016 when the initial work began with expanding with work with adolescents and young persons between the ages of 15 to 21, and then increased these or expanded these age ranges based on the needs, as she has earlier explained, to cover for ages 10 to 24 years. And the work was done with 66 health facilities and 80 schools. Basically, that was done to, one, provide the specialized fast-track linkage to care. As she did point out in the introductory slides, that we needed then to ensure that those adolescents and young persons who had recently been tested were immediately or linked almost immediately to care and ultimately retained in care within that period. And then two, we also had a platform for meaningful involvement of adolescents and young persons in the design and implementation. As she already pointed out, the young people did design the Red Carpet VIP Express cards and the related tools that were used in the program right from the onset. And again, the implementation at this point was done with the healthcare facilities, which were 66 in number. And then that began in Homa Bay, one of the counties in Kenya. And through the expansion, we then did include Turkana County. Again, the peer involvement was key approach in this implementation, with the young persons coming together under what we called the Adolescents and Youth Advisory Committees, which then were responsible for providing advisory to both the program implementers as well as the facilities, and advocating for the improved quality of services for their peers within the facilities. Through their groups, again, they would engage at the beyond the facility up to the sub-county and county levels to continue to articulate issues affecting young people and their access and utilization of services. Then the other core component was that we also looked at the boarding schools, noting that young people who are in school were experiencing a lot of barriers in one, either taking their drugs in school or adhering to the times when they are supposed to take these drugs, or stigma and other related discrimination in school. So we had to work with the schools to also make them HIV responsive, in the sense that the school then owned the response and worked with the young people to provide the spaces for storing drugs. They conducted directly observed therapy for learners living with HIV on care at that point, and also supported them for their clinical appointments. Coming into 2021, the focus for the implementation was therefore to bring this evidence to scale to the national level, and setting up 3 centers of excellence, which were within the health facility. The other component was to set up centers of excellence within the schools, but this has been affected by the effects of COVID on the education sector, and therefore that has remained a challenge to date. Next slide. So in terms of just looking at the evidence that now informed our expansion of the same program even to Malawi and bringing it to you, was that immediately after the first 6 months of implementation, we actually did a pre-post implementation evaluation of this program, and did note that from the manuscript that we actually posted if you can see on the right top corner, and you can provide get that link. We did note that within 6 months, we had actually seen a number of young people who had been tested being newly diagnosed, linked effectively to health services, increasing from an initial 56% to 97% within the period of 6 months. Again, we did see that there was an increase in the number of, in the retention rates from an initial 66% to 90% at 3 months. And at 6 months, we did see that we had also increased that retention from 54% to 98%. And just from the screen, you could see that we just took a snapshot of the 3 centers of excellence performance for November. And from that, we do see that the intervention has sustained very high linkage rates of 90% and an overall viral load suppression of 96 within the centers of excellence, which therefore continues to demonstrate that throughout the phases of the implementation of this intervention, we are seeing that it is still serving improved outcomes for adolescents and young persons right through the identification, the early linkage and retention, as well as achieving higher levels of viral suppression. Thank you very much. Let's get to Malawi, and my colleague Cosima will share that experience.
Thank you, Job. Unfortunately, Tessa, who's the activity manager for Red Carpet in Malawi, is unable to join us today, so I'm going to be stepping in for her portion. Next slide. Thank you. So in April 2020, Malawi began piloting the Red Carpet model in Blantyre at 4 pilot sites, and the Red Carpet elements implemented in Malawi were adapted to meet the local needs, but did maintain similar objectives to those in Kenya in terms of providing specialized fast-tracked linkage to care, ART initiation and retention services for newly diagnosed adolescents and youth living with HIV. And so EGPAF Malawi's implementation of the Red Carpet project consisted of different approaches, with the provision of the Red Carpet suite of VIP fast-track services, which were shared by Natella and Judith prior. So those are the same things that are implemented at the facility level here in Malawi with the express desk and the VIP cards. And this is supported by VIP response teams, which are multidisciplinary facility-based teams it consists of like providers, counselors, and also youth champions who are a trained youth cadre who support identification and linkage and retention efforts and activities at the facility, but also in the community through home visits, for example, for adolescents and youth who are experiencing difficulties with adherence or retention or other psychosocial support matters. Next slide. So the initial data in Malawi shows improved identification, linkage, and retention among adolescents and youth living with HIV, which is excellent. The graph on the left shows the cascade among the 4 pilot facilities, comparing a pre-implementation period, October to December 2019, to the initial 3 month of implementation in the period of July to September of 2020, which shows a positive impact of implementation in terms of increased identification and linkage to ART, with improvements from 5 to 10% concerning identification and 94 to 99% linking newly identified adolescents and youth to care. The graph on the right shows the cascade at the facility level at the 4 different pilot sites, as you can see underneath on the x-axis. And this shows that 159 in total, so 99% of those newly identified positives were linked to ART and the Red Carpet program. Retention, it's not shown on the slide, but since the start of the project in July and in the period July to December 2020, for those in the Red Carpet project, that was 97%. And a significant contribution to these results is the work and the dedication of the youth champions. So I'm really pleased to be able to introduce Robert, a youth champion who has been part of Red Carpet since the start in Kenya. And he's going to share a little bit more about his role and his experience.
Yes, thank you once more. I'm Robert from Kenya, youth champion. It has been a very good experience 2016 when the program started, the Red Carpet program. By then is when they identified that adolescents needs more attention than anything else. So the introduction of VIP express services really helped to increase retention and also linkage amongst the youths and adolescents. That made us to become very experienced and also have to know ourselves that we can be a very good champions. Out of the program and the experience that I had from 2016 to 2021, it has really helped the facility to, and especially the engagement of meaningful youth engagement has really helped adolescents to maintain their medication, and also the ones that are newly enrolled, they're really doing well with medication, and also retention is really increased as percentage is concerned. The introduction of VIP express cards has really helped the adolescents to maintain their coming to the facility and also to get the services they need, as from the desk, from the express desk to the express room, and also to the clinician where they get more services, and also outside the facility. It has really helped to increase linkage, because since the client or the adolescent has been tested positive, the first person to be engaged is the adolescent champion. And you know very well that AYPs really have a lot of issues, and they really have a unique way of handling their problems. So, and also on the other hand, youths really have their own language of talking. So with the introduction of peer champions within the facility has really helped to maintain the linkage, because they really share a lot. And also the peer champions, the opening up of the peer champion to the other newly enrolled really motivates the other one, that he or she is not the only one, but this is a joint thing, and also there is life after being positive. Also, the support of retention is really doing well, because we'll be doing a follow-up on the adolescent. How does he or she is taking the medication, and also how does she is doing on other issues around the care and treatment. Also, the navigation of services is also another key role to the adolescent champion, where where always we really act very fast, because the adolescents and the AYPs do not really like to wait. They don't want to waste time, and also by the time they have been got with the virus, they really have a lot of questions on their head. Where did I get it, and all that, and maybe stigma is also involving around her mind. So we also do referrals to the ones that really has problems. We do referrals to the OVC programs, maybe for nutrition and also peer support. We also do referrals to the SRH department, where maybe someone is raped or something, or maybe molested with others, or someone has really had another problem. We also do support, psychosocial support, where we engage other adolescents, because since they have the specific dates or specific clinic days, especially on a weekend day, so we engage more youths and adolescents. Also, we identify more champions to help in the program of giving health talks, and also in the as far as art is concerned, and also by mentoring others to become champions, so that whenever whenever the other person is not around, the progress continues in a successful way. And also peer-to-peer support is also very key to adolescent champions, because some of them really have special needs and special problem. So we have like an adolescent champion must take care of the situation at hand. Also, facilitating the VSP express services is also a big thing to the facility and to the AYP, since that we have the express desk, the express room, and also the express card. All this will be done by the by the youth champions, because he or she knows and understands more of this red carpet VIP express program. So it has really helped to maintain the retention, because whenever the adolescents come to the facility, they within the supported areas that are being supported by red carpet services, the healthcare providers have been trained on the basics and on the information about the red carpet express card. So whenever they produce the card, it is easy to help out and give the adolescent express service in a better manner. The meaningful youth engagement has really helped a lot, because without the engagement of youth, now I think even Robert could not be a youth champion as for now. And it has really helped us to gain more knowledge and also to have a better plan for ourselves. And I'm very happy about that. Since 2016, we really have so many champions, and also we've managed to start a youth group within Oma Bay that cater for adolescents that are still having problems within their respective areas within Oma Bay. And it is really doing well, just because of the support that we got from the red carpet since it started the since it started 2016. So that is a really good thing, and I could have encouraged that one to happen. Also, coordinating activities and care within schools. This one has really helped to in disclosure support from the facility or from the school area. We really, whenever we have issues within the school, or we have mapped schools that the AYP comes from, and also we go there to do health checks, and also we go openly. We talk more openly about our status, and that one really encourages other adolescents that are within the facility or within the schools, and maybe they have not done disclosure, or they have been really wondering how they could start opening up. So the opening up of the adolescent champion within the school, it really brings the disclosure part of it to be very important to an AYP that is within the environment, and also the trainings and empowerment of youths within the school, and also empowerment of the school teachers and maybe matrons has really helped to increase the retention of school going AYPs. And also the introduction, whenever we go to a school, we really initiate a health club where they talk freely, and also they talk more about their health, not only HIV, but maybe SRH and everything that involves around AYP. And also I can thank ViiV Red Carpet, and also EGPAF for the good job that they have been doing. They have really made us to be strong, and also the good work that is going on should be kept on going, because it has really helped adolescents, and really adolescents are really appreciating the service that you've given them. Otherwise, thank you, Robert from Kenya. Thank you.
Next slide, please. Thank you so much, Robert. We really appreciate you sharing your experience. Hi, everyone. My name is Brian White. I'm an adolescent technical advisor with EGPAF in Washington, D.C. Next slide, please. So we're going to look here at opportunities for adapting the red carpet program model. There's lots of challenges that adolescents and youth are facing. We heard that really they're not just one group, and really approaches that can reach and provide differentiated service delivery. And there's lots of challenges that are being faced across the cascade. You can see the points in blue: testing, linkage to care, retention, adherence, being able to get your viral loads and staying suppressed. These are all really big challenges that a lot of programs are trying to deal with. And we found through the Red Carpet program that really, and as you saw in the slide presentations from Malawi and Kenya, we've been able to address a lot of those issues and really improve the services to youth, making sure that they're very adolescent and youth friendly. And as you heard from Robert, the role of youth and peers is critical to success in these programs, and it can't be just tokenistic. It really has to include planning, implementing, evaluation. The youth can be involved in all aspects of this and really provide value to a program and making sure that the services are meeting their needs. I'd also like to highlight that the red carpet package is adaptable. So whether you have a current program running already, there might be parts of the package that can supplement what you're doing. Or if you're just starting out, it can absolutely be used comprehensively to get your program going. It's also really adaptable to the local context, and we really hope that people would take the time to do that and make it work for their situation and environment. It also really allows for program improvement, both with things, so that you can identify what's working well and what's not. But it's also adaptable to new technology and innovation. So if you think about long-acting formulations that are coming out or multi-month dispensing, all of that can fit into the red carpet package. And so I just also want to highlight in closing about the adaptability is that we are developing different training modules for this, and those will be available shortly, and we'll be sharing them. So please look for that coming in the very near future, and that will help you to be able to roll out a red carpet program similar to that. Next slide, please. So now we're going to move into our question and answer period. We're really encouraging all of you to participate in this. We already have 2 questions in the chat box that we're going to start with. So anyone else, please feel free to write your question in there. And you have to make sure that you hit send. To ask a question verbally, click raise hand in your toolbar or *9 if you're on the phone. And we can have a chance to do that. We don't have much time left, unfortunately, for questions, but we'll see what we can get through. And also respond to us, and we'll get back to that today. So I'm going to start with the first question that came from Katie. How have adolescent and integrated services been impacted by COVID-19? Are adolescents being more greatly impacted than other populations? I wanted to see, Job, if you could maybe take a first stab at this.
Yeah, thanks, Brian, and thanks for the question. Indeed, it is true that when you look at the factors that influence adolescents, either as barriers or facilitators in their access to the facility, one of them is actually the parental communication around access to facilities and the like. And with the COVID and stigma that was associated with it, we did see that quite a number of young people received information that kind of reduced their interest in accessing facilities, other than what we've always known, that generally young people have poor health-seeking behavior compared to the adults. So it is indeed true that during this period, even as we implemented even within the centers of excellence, we've seen that there is a declining number of young people accessing the facilities. However, what has worked for us is that we did engage the peer champions and the facility teams to conduct virtual case management, which then improved still their access to services. In addition, we also had the multi-month dispensations to address the frequency with which the young people come to the facilities. So we did note that, but again, we did respond to this through those 2 approaches. Thank you.
Thanks so much, Phil. I appreciate that response. Next, the question 2, Cosette asked, as the RCP was adapted from a DC-based program, so definitely a US context, can you speak to more to the process of adapting from that to the African context? I'm going to hand this over to Natella.
Sure. Thank you, Cosette, for this question. And you're totally correct. I didn't want to take time, but the red concept The red carpet concept was developed in DC around 2010. It was developed by Department of Health for all healthcare facilities. And the goal was to speed up the linkage to care after positive test. At the time, DC witnessed significant percentage of new diagnoses coming in a late stage of disease. And the goal was to make sure that the patients are linked to care within 72 hours. And if the facility was able to do that, then it granted the status of red carpet. And indeed, there was a map, and it's still, I believe, available on Department of Health's website of the facilities that have the capacity to do it. The big difference is that we have ample federal funding through majority of the programs in the red carpet that support services like case management, nutritional support, even including transportation. So the base of this program were expectations to have some available infrastructure and funding support to provide this kind of services. Second, it was aimed at all populations, primarily adults in DC area, and not specifically for youth. So what we did, we really took the concept of treating the person living with HIV as VIP. And when we approached first Kenya team with the idea from ViiV and the funding opportunity, we from beginning wanted to make it, first of all, youth-oriented program, and second, to really be developed with available resources, recognizing that even with the funding support, we probably will not match all of the resources available in a country like United States. So it was really designed by youth with available resources and infrastructure available, with some complements, obviously, with our additional staff and the time dedicated to that. And another big element of difference was that we really brought in educational sector very early on. So we did start from the grassroots, more or less. The first conversation we had about this program and the concept, and even the name, whether we are going to keep the name red carpet as a concept of VIP, which is globally accepted motion, was with young people. So the major difference is youth generated, looking at available resources versus just, coming with this mandate. And then as you saw, the program really evolved to not focus only on the linkage to care, but go all through cascade of retention. I believe it's answered the question. Back to you, Brian. And happy to do more details by email if any.
Great, thank you so much, Natella. I appreciate that. I'm going to hand the question from Happy Betty over to Joe, where she's asking about healthcare worker attitudes, as well as being able to provide incentives, both at the school and to the healthcare workers. Joe?
Yeah, thanks, Brian. And to Happy's question regarding healthcare workers, the first part of the program began with the sensitization of the county health management team and the leadership, so that the program is owned by the Ministry of Health at that level. That was important in ensuring that we get the necessary support. But coming down to the healthcare workers who are all equally sensitized on the program, we did realize that, yes, some of them were required to come to the weekend clinics, which meant that one, the facility in charges had to work with the healthcare workers on their kind of rotation, so that the same people may not be required to be available every time for the weekend clinics. And two, the two counties or geographies where we began the implementation of this program were also counties that had existing EGPAF programs that were also supported through the PEFAF programs. And this also allowed us to also have some of the human resource for health supported by the programs, and therefore they were more likely to be available for this kind of weekend or convenient clinics. However, we did note that, yes, it became important that sometimes we provide a transport reimbursement or lunch where applicable in cases where healthcare workers needed to be working over the weekend and the facilities did not have a proper rota system to be able to cover for that. The second part to your question is the schools and whether there were incentives for staff who are involved in this. Now, to work with the schools, we did also begin by sensitizing the school leadership, ensuring that we created a school health committee or strengthened the existing school health committees, the appointment of health focal points, and training the cadres in school, including the matrons and the like. So the schools ultimately then made the determination in terms of who, whether it was a teacher or a matron or a nurse in a school where that was available, that would be providing for DOTS. Was there any incentives? We only did recognition for them and the trainings, and we realized that that worked for the schools very well. So a number of the teachers who are sensitized, supported, felt that this was actually something that they were proud to continue doing as they were making a difference for the learners living with HIV in the schools.
Thank you so much, Joe, for that. I really want to be respectful of people's time. It's now just 2 minutes after 9 o'clock, and so we haven't been able to get to all of the questions that people asked, and there's just some really great questions, especially around scaling up. Nicole, I appreciate your question there about how we're going to do that and whether we're going to do an evaluation of it. We were just talking about that the other day. And so in Kenya, they're definitely working with the National Ministry of Health around the model and moving it forward. And as well, being able to look at an evaluation is something that we want to do that comparison between where the program was implemented and where it's not. We're going to ask everyone if you could please email your questions to publications@paids.org as it lists there on the screen. And we definitely will want to answer them as much as possible. We thank everyone for coming and participating. If I could just have the next slide as well, please. Here's some contact information for those of us who are working closely on the program from here in DC. We're also going to, happy to be able to answer any questions or follow up that you might have specifically around that. So once again, thank you so much everyone for participating, and thank you to our panelists. And in particular, thank you to ViiV for their support and participation today. We really are enthusiastic about the Red Carpet program, and we look forward to seeing where it goes. Thank you everyone, and enjoy your day.